This is UCTV Health Focus.
Thank you. The name is Dr. Zaake Daniel, a senior consultant obstetrician and gynecologist, but also a fertility specialist. I'm based in St. Francis Hospital in Zambia and the Lifeshore Fertility Center. I am trained with Makerere University, but I've got several trainings abroad for the subspecialty. Yes, I've been a doctor for about 23 years, but an obstetrician gynecologist for the last 17 years, based mainly in Zambia Hospital. Of course, in Zambia Hospital, we also have a medical school, a postgraduate training school, where we train postgraduate doctors, specialists in obs and gyne. Yes, and I'm head of obstetrics and gynecology at the Zambia Hospital. Okay, in our practice, we address obstetrics. Obstetrics is the care of pregnant women and their pregnancy. We have gynecology, where we look at women disease conditions, where we have the fibroid, cervical cancer, abnormal bleeding. Then we have adolescent health. Yes. Then we have gyne cancers. Yes. Mainly those are the areas we look at. Then we have reproductive health, where we look at hormonal issues and issues to do with infertility. Here we look at both the women and the men. Of course, it's important when you are looking at preventive and prioritizing women issues. You will look at issues to do with health education. You have to educate women on different reproductive health issues. You have to look at the issue of sexual and reproductive rights. You have to look at screening services, especially breast and cancer screening. You have to look at issues to do with antenatal care, forecast antenatal care. You have even to look at issues to do with infertility care and reproduction. You have to look at issues to do with counseling services. You have to look at issues to do with women mental health. Yeah, many women issues cause a lot of depression, anxiety, okay, both without conceiving or conceiving. And you have also don't forget the issue of menopause. Okay, many women quietly suffer with the issue of menopause. The role of an OBG, okay, mainly is obstetrician. So with the start circuit from preconception, yeah, you should be able to educate the women on preconception care. There are even some women you may have to talk out against conception, especially people like sicklers, people with chronic diseases. You have to weigh the options of what they pregnancy. Then we have the big one, the antenatal care. You've got to encourage women to come for antenatal. We have the routine antenatal, but even during the antenatal where they are checked, examined for conditions, they are also done lab tests. Then they are given preventive medicine, prevent some conditions like malaria, then deworm them. Then they are given supplementation like iron. Then there they can be detected things like high blood pressure, or if they have any other risk, previous cesarean births, previous hypertension, any other complications. Then during labor, you're supposed to really be able to monitor these mothers or to be able to pick out any mothers at risk, because fortunately the majority of women, that is up to 85% of the women will go through labor without any problem, maybe without the need of a gynecologist. But there is that 15%, yes, which will develop complications, and the complications are so bad that they many times lead to maternal death. Okay, so that there you need to come in as an obstetrician. As in Zambia Hospital, we are at the level of a national referral, so we get a lot of those complicated cases which actually require our intervention. Mothers with excessive bleeding during or after birth, high blood pressure. We have mothers with medical conditions, diabetes, yes, and all that. So during labor, your role is really critical, and you have to make the decision between a normal birth and what will have to end up into a cesarean birth. Yes. Then after delivery, the story doesn't stop there. As we know, the commonest killer of mothers in the after delivery period is bleeding, excessive bleeding, which is PPH. It is still the number one leader of kill. So we don't abandon these mothers. We make sure you anticipate it, we try to prevent it, and always be there to manage the complication with the other team of nurses and doctors available. It is very, very important for mothers or pregnant women to seek antenatal care. During the antenatal period, first, this is when they can be examined to know that their pregnancies are okay. Two, they do tests to find out if there are any risk factors. Even during the antenatal period, some conditions develop for the first time during pregnancy. Some woman may be normal, but she may develop high blood pressure for the first time during pregnancy. Because of pregnancy, she may develop diabetes for the first time during pregnancy. She may have underlying heart disease and may get worse because of pregnancy condition. Two, during pregnancy, they screen them for HIV, syphilis, hepatitis. All these conditions can contribute to the detriment of both the mother and the baby. Then during antenatal, they are given preventive medicine like prevention against malaria. Then most importantly, during antenatal, they are given health education about good nutrition during pregnancy, danger signs, because while she's at home, she may be the first person to notice something. So they are given those lessons on danger signs during pregnancy, and that is when we can help her. Because if she notices danger signs and stays at home and does not come to the hospital, then we cannot be able to help her. Then, of course, that interaction with the doctor, we are monitoring both the well-being of the mother and baby on a regular basis. A lot can happen during the pregnancy, and unless the woman comes for her regular visits, we may not be able to pick up these issues. I think one, it is attend antenatal. Attend antenatal at least 4 times. If more, the better. But at least, because on average, you're expected to attend maybe about 7. As soon as you know pregnancy, you discover you're pregnant, then you begin. That may take you, like, if you do once a month, that's about 8 times. But you say at least a minimum of 4, if you really can't make all the 8 times. But we would love to see you on a monthly basis. 2 is proper nutrition. Okay, endeavor to take a balanced diet, rich in protein, rich in carbohydrate, rich in vitamins. Okay, do your supplementation during they give them supplements for iron, very important for both of them. Then a lot of rest. Okay, while you're pregnant, it is very advisable to take time off and have enough bed rest even during the day. Okay, don't work like a horse during the whole day and think you'll only rest at night. That brings a strain on your pregnancy. Be able to take time off and take some naps, even if they're 30 minutes, 40 minutes. They help rejuvenate your energy and nourish also the baby. That is my area of specialization. So issues to do with fertility and infertility, first of all, they need to be handled as a couple. It is important that you encourage any woman or man trying to produce and they're having challenges. And of course, infertility is defined as failure to reproduce after 1 year of trying, unprotected sex. So you encourage the couple to come together. And when they come together, then you do the screening tests. Okay? The women have a lot of screening tests. We check for the tubes, we check the uterus, we check the hormones. For the man, mainly we check the sperm, or we do semen analysis. And this may tell us a lot of issues. And then, so these people are normally given counseling, and then appropriate treatment can take place. First, there could be examination, more clinical examination. For example, checking the blood pressure. 2, checking their breasts. 2, having abdominal exam for any abdominal masses. Then they could have imaging, radiology. Okay, they could have a scan. Okay, yes, commonly I think the scan would do. Then in the lab, they can check for hormones. They can check for the thyroid. They can do the infectious tests. They can check for syphilis, HIV, hepatitis, because all these have a bearing on their reproductive health. Then for still the clinical, breast examination and also examination of the cervix. They can have their cervix checked for any abnormal lesions. I think it all comes from the health education, okay? And you should be able to give these health education talks as much as possible. These days we are lucky, we have a lot of media, we have the radio, we have the print, the newspapers, we have the television. So whatever opportunity you get, you talk about these conditions, okay? You can be specific and talk about breast cancer and its dangers and why women, or you can talk about cervical cancer and the dangers and what screening. You can even get time off and try to describe even what really goes through, because some people think maybe you may need to be cut or whatever. So most of the screening tests are non-invasive. You don't need to actually operate or cut the woman. So they are fairly safe and they take a few minutes. And these days we have even empowered the midwives. If she may not be comfortable with a male doctor, you can say, yes, I can get you a female doctor or a midwife to actually carry out this test. I think most of the advancements have been in gynecology. The big one is the keyhole surgery. Yeah, nowadays there are a lot of operations we can do without opening the whole abdomen. Of course, there have been new discovery in management of infertility, including top-notch technology. There have been advances in management of the cancer, both breast and cervical cancer. There have been advances in even screening for some of these cancers, even screening for both cervical and breast cancer. For obstetrics, I think the advances have been more in detecting any abnormalities with the baby, okay? Because before it was difficult, but now we have a lot of nice imaging tests which can detect any abnormalities with the baby. We have even screening tests for genetic abnormalities. Even when the baby is still in the uterus, they can take off samples of the baby's water and they check, and you can be able to detect. The imaging has really improved, that they can catch baby abnormalities very, very early, and in centers where they can even operate a baby when the baby is still in the uterus, and they correct that defect. That technology is available. Of course, the technological advancements have improved in such a way that we have lesser women dying from pregnancy-related complications. We have lesser women suffering and dying from gyne-related complications. Of course, in obstetrics, when you talk about the mother, you talk about the baby, okay? So we have better care for the babies. Something I forgot to talk about when I talked about the advances. We have better care for the babies. The advances now, we can save babies even 1 kilo or less. Okay, that means like at 7 months, 8 months, these babies now can survive with the technology available to support them to grow and feed and breathe. I think the challenges are mainly the availability of services, the quality of services. There's a big disparity between the rural and those who get urban services. The transmission of health information. I feel the media has not done enough in supporting the health sector in transmitting down this health information. Then also we still have a lot to do with the alternative medicine. I don't want to call them herbalists, okay? Yes, yes. We have the traditional birth attendants, we have the herbalists, we have the witch doctors. These are still a big force in our communities. They still command a lot of respect from our communities, and their messages sometimes are misleading, and they tend to derail messages. But we also have lower level health facilities which have delays in referring women with complications. This one we want to appeal to them that once you realize that you cannot handle the woman at that level, early referral is very critical, because when you refer them very late, sometimes very little we can do. For example, if you've delivered a woman and discover she started bleeding and you have a feeling that you're not in control, please refer this mother. But also sometimes the mechanism of referral a challenge, especially late in the night. Okay, yes, sometimes that can be access to the facilities from the referral units can be a challenge. Most of these facilities don't have transport to transport these women. They hope to refer. I think what I have noticed is that the evolution of social media is strong. Okay, people spend a lot of time on TikTok, so it would be nice if some of these health education talks can be coined to suit that fora. People watch a lot of television, so they can have designated times, even within news flashes. Then you know that maybe on a daily basis there's a 1 or 30 minute, 30 seconds flash on a different topics, and you just keep, as long as you keep reminding the mind, it keeps up. Okay, then the radios, I am sure these radios reach a very wide population. Let them make time for these talks. I know I hear a lot of political talk shows all the time, all the radios talking politics. Let's make time for the health also and talk about it as much as we talk about the politics. I think mothers out there who are suffering from mental illness, it is very important to talk to someone. We have a very strong counseling and psychiatric department at St. Francis Hospital in Zambia. They can come or even talk to doctors, because in our training we have been trained to be able to be counselors, to do a lot of counseling. So we can be the first contact point. Talk to a health worker, share your experiences. An experience shared is half solved.